All right, welcome back in here to Live Now from Fox. I'm Andy Mack. More potential federal buyouts on the table for employees. This now coming with the Health and Human Services Administration. As you can see, this a post from Politico saying the top U.S. health agency makes a $25,000 buyout offer to most of its employees. We're following the latest as most of the 80,000 federal workers responsible there for researching diseases, inspecting food, and administrating Medicare and Medicaid under the Health and Human Services Department were emailed with an offer to leave their jobs for as much as $25,000 as part of President Donald Trump's government cuts. Workers cannot start opting in until Monday and have until 5 p.m. on Friday to submit a response for the so-called voluntary separation offer. The email was sent to staff across the department, which includes the Centers for Disease Control and Prevention in Atlanta, the National Institutes of Health, as well as the Food and Drug Administration, both located in Maryland. The mass email went out to a, quote, broad population of HHS employees, landing in their inboxes just days before the agency heads due to other offer plans for shrinking their workforce. HHS is one of the government's costliest federal agencies with an annual budget of about $1.7 trillion that is mostly spent on health care coverage for millions of people enrolled in Medicare and Medicaid. The agency oversees health insurance for roughly half of the country through Medicare and other older adults for Medicaid for disabled and poor Americans. So big developments in terms of that as the deadline coming up on Friday. All right, we're also following more information about another outbreak of measles, this one coming right now in Maryland, as I want to put up just some information about this here on Live Now from Fox as what we are learning in this case as health officials in Maryland confirmed Sunday that a Howard County resident has tested positive for measles after traveling internationally. The case is unrelated to the current measles outbreaks in Texas and New Mexico. Out of an abundance of caution, authorities are working to identify individuals who may have been exposed to the virus, including contacting passengers who have been on certain flights and visited specific locations where exposures could have occurred. So those include the Washington Dulles International Airport, also Johns Hopkins, the County Medical Center there. Those 2 dates on March the 5th for the airport and March the 7th on the medical center. And I also want to put up just this, a post from the Maryland Department of Health talking about this, the announcement of a measles case in a resident who recently traveled abroad. Like you mentioned, as we mentioned, the abundance of caution, health officials are working to identify people who might have been exposed. And that's notable because early symptoms of measles are a fever with more than 101 degree Fahrenheit, runny nose, cough, red and watery eyes. Usually 1 to 4 days after early symptoms, a red rash appears on the face and spreads to the rest of the body. The measles symptoms typically develop 10 to 14 days after exposure to the virus, but can develop as soon as 7 days and as long as 21 days after exposure. A person with measles is contagious beginning 4 days before the rash appears until 4 days after the rash begins. So some developments there about this, and they're talking about those. If you were at Washington Dulles International Airport Terminal A, they're asking people to be aware of this, talking about March the 5th between 4 and 9 p.m. They're asking anyone who visited the following locations, they may have been exposed. Also, Johns Hopkins Howard County Medical Center, the Pediatric Emergency Department on March the 7th between 3:30 and 7:30. So as we're following this very closely here on Live Now from Fox, those outbreaks now spanning New Mexico, Texas, and also in Maryland. I also want to put up just this, some statements from the HHS Secretary, Robert F. Kennedy the third, of course, Robert F. Kennedy Jr., as he was talking about this in a op-ed for Fox News Digital, saying the measles outbreak is a, quote, call to action, talking about vaccines, saying vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. So certainly gaining the attention, as we saw in that first cabinet meeting, a question about that to RFK Jr., now this in Fox News Digital, talking about vaccines are there to protect people, but also contribute to the community at large.